Varicose veins are definitely one of those issues that does not discriminate, affecting about 25 million Americans. Until recently, the only treatment options were to wear uncomfortable compression stockings or to undergo painful surgery to remove the veins. However, now there's a high-tech procedure that's bringing relief to patients in mere minutes, right in the doctor's office.
Fernando Gonzalez Velez loves being a nurse, but the long hours on his feet that go hand in hand with the profession leaves his legs achy and swollen and aggravates his varicose veins.
There is a discomfort. Sometimes it's like a burning pain to it. There's also some swelling at the end of the day, and especially on my left leg. You can see that the blood flow is not all that good.
Varicose veins are sometimes hereditary, but there are other risk factors.
People who have a job that they're standing or sitting all day tend to have more varicose veins. Women tend to have more varicose veins because of female hormones. Pregnancy increases the risk of varicose veins, age, and there's several other factors.
Fernando first saw a doctor for his varicose veins more than 10 years ago. At that time, compression stockings were prescribed to relieve the symptoms, but Fernando found them too restricting. Today, people who suffer from varicose veins have better options.
Currently, we use a newer technique with laser to get rid of the vein that's causing the varicose veins. Usually there's a feeder vein feeding the varicose veins, and we can laser that closed now.
Dr. Vasi Gardikas and Dr. Deborah Gumina, surgeons from Valley Surgical Specialist Medical Group, both perform a procedure called Endovenous laser treatment. It works by inserting a catheter containing a laser which heats the inside of the vein, causing it to seal shut and dissolve.
It's going to be cold soap on you here.
This is Fernando's second procedure. Dr. Gumina successfully treated the varicose veins in his right leg, and in less than an hour, with local anesthesia, she will remove the varicose veins in his left leg.
The procedure happened to be almost pain-free, and surprisingly, one waits and waits for the pain, and it never comes. So.
You're doing okay?
Mm-hmm.
Arteries carry blood down to your extremities, and veins carry the blood back to your heart. And so when those valves in the veins don't work, you get pooling of blood, and those veins distend, and that's what causes varicose veins.
In addition to aches and pains, symptoms can include cramping, skin discoloration, and skin ulcers, and symptoms often worsen during pregnancy.
Long term, you actually develop venous hypertension. You develop high blood pressure of the veins, and that can lead to chronic swelling in the leg. And the end result of that can actually be ulceration, where there's no ability to heal the skin.
We're going to try and give you a picture of the laser here. Can you see that? Barb?
She's going to test it.
Okay, we're going to test it. Those are the bubbles that you can see, and you'll see them in a minute.
Following the procedure, Fernando can resume light activity, but will need to elevate his leg some. Patients can usually return to work after 3 days, and strenuous aerobic exercise is discouraged for a month.
To me, the worst is having to wear the stocking for 2 weeks. It's kind of comfortable, but that's about it.
That sounds like a pretty reasonable recovery request when you consider the long-term benefit of being free from leg pain. The laser treatment also successfully treats spider veins, but this is usually done for cosmetic purposes and will likely not be covered by insurance.